So I'm Dr. Jonie Girouard. Welcome. We are going to talk about detoxing for lipedema. This is our 101 webinar. It is not the course. The course is 4 sessions. This is the 101, and I'm going to share my screen, and we are going to get started. All right, so hopefully everybody is in the right place. We are at Lipedema Detox 101. And I'm Dr. Jonie Girouard. I do have a real quick disclaimer to put out there that this is intended for educational purposes. It is not intended to replace the advice that you're given by your medical team that knows you personally. So unless you have a one-on-one relationship, you really should not take anything that you see on social media, whether it's through webinars or different posts, as advice for you medically. You need to have that personal relationship one-on-one. This is just being done to help you on your journey to find more resources to take care of yourself better and to improve your lipedema. So again, I'm an obesity medicine specialist. I am also the founder of Lipedema Clinic. It's been a 6-year project, and we are finally there, which is fantastic. So this webinar is for you if you took our lipedema quiz and you scored 2 or more on it. That may be you. If you have lipedema or you know somebody who does have lipedema, they often will feel stuck, frustrated, misunderstood, and not very happy about the way they have been treated throughout their weight journey. Many of the women here will have tried countless diets, exercises without lasting changes, often bariatric surgery. So we have a lot of patients that come to us that have had previous bariatric surgery and are frustrated because they didn't get the outcomes that they wanted because they had lipedema. If you want to see a clear, proven path forward, we're glad you're here because that's what we hope to provide for you. If you feel let down or overlooked by medical professionals, please know that you're being heard now. By the end of this webinar, these are my objectives for you, but you may have different objectives. So I want you to know exactly what lipedema is, why it doesn't respond to traditional diet and exercise. It does respond to correct diet and exercise, but not traditional weight loss efforts. Lipedema is caused by increased larger fat cells and fluid retention, and what actually is causing that in lipedema. And why does it progress? I want you to understand all of those things so that you can do something about it. And what are the ways to get started on your tackling journey of lipedema? And that's oftentimes through detoxing and reducing inflammation, which is probably something new that you haven't heard about before. So those are my objectives for you. But I'd like you to take just a couple seconds on that piece of paper that you have, and I want you to write down what is the one thing that you want out of this webinar. And I don't know what that will be. Everybody is different, but I would like you to think about what is it that you would like to gain from this webinar. And if we don't write it down now, we'll forget, we'll get distracted. That's what I usually have my patients do when they come in new. I ask them, if you have a question, I want you to write it down so we can make sure that we address that before you leave today. So why do we do this? Why am I doing it? And why do I have a whole team that's now working with me? And it's because of the women that we serve. And so I'm going to share with you some patient stories. Obviously, their names have been changed in some of their details, but these are the patients that we see every single day. So Becca, she struggled since puberty with unexplained weight gain, despite being very fit, being active in sports, and trying all different types of eating plans. She was very frustrated by the doctors that had repeatedly blamed her and her weight on her lifestyle choices. She had done everything that they had asked and then some, and still didn't get the results they told her that she should. She did go ahead and have bariatric surgery in her 30s, and it resulted in normal loss of fat around her abdomen and some of her visceral fat, but her body shape just looked even more disproportionate. So she had a very thin trunk and abdomen and very large arms, hips, thighs, buttocks, and lower legs. So those areas did not respond to the bariatric surgery, and it made her look very disproportionate. She realized that she had lipedema and that it was not her fault. So she was pretty excited when she finally found out that it wasn't excess body weight from obesity, but that it was something that was passed on to her. Susie had a very, very similar story as well. The difference here was that not only had healthcare professionals blamed her for it, but they started to yell and accuse her of lying to them and different things like that. And it was very, very frustrating for her. So to the point that she really didn't want to see doctors at all, and definitely didn't want to talk about her weight. Whenever she'd go in to see a doctor, they'd start talking about her weight. And she's like, I'm not here to talk about my weight. I have a sore throat. And many of you may have had similar experiences with the healthcare teams that you have seen. It's not uncommon. The difference with Susie is that she had also gone through a variety of liposuction surgeries, in fact, 3, and then the lipedema tissue had returned, and she didn't understand why not only bariatric surgery didn't work for her, but lipedema surgery didn't, or liposuction. And then we saw her not long after she had had a Mirena placed for control of her endometriosis. And despite her specialist and her primary care provider telling her that the Mirena could not cause weight gain, she had experienced an over 30-pound weight gain despite nothing else in her life changing. So many of you may have been told that an intervention shouldn't cause weight gain, but it did. And you're not alone. So when we found her, it was at one of our live events, and she came in and found women just like her and was just so happy to know that she was not alone, and none of you are either. Miranda, she is a little bit different case. She was or is the daughter of one of our lipedema patients. And so she had learned about lipedema from her mom. And so if any of you have children, I want you to be empowered to have those kind of sometimes difficult conversations with other family members, because it was amazing with Miranda that she had started to notice some changes in her puberty years around age 12. We saw her in her early 20s. And she had started to notice changes just like her mom, and her mom got her in to see us, and we started changing what she was doing every day, diet, activity, supplements, those types of things. And she was able to prevent progression, at least as of right now. And so she's still in stage 1. And with those interventions, she actually lost about 20 kilos, which is pretty exciting for her, and is not following the same path as her mom. So why do we do this? It is our mission to provide support, raise awareness, and offer resources to women and their loved ones about lipedema. So we want to reach as many women as possible, and I'm super glad that you are here, and I'm hoping that you will share the information that you learned tonight with others. Don't keep it to yourself. It's time to talk. So what is lipedema? It is the most common inherited subcutaneous adipose and connective tissue disorder affecting women that does not respond to typical calorie restriction or exercise. And that's a long definition, but by the end of this session, you will understand every little bit of that description. Okay, so bear with me. So what is lipedema? It's common. It affects 1 in 9 women, about 11% of adult women in the United States. In other countries, it has different penetrance. For example, in Brazil, I think it's like 12.7% or something like that. So it's even more in certain countries and a little bit less in others. It's an inherited condition, and I'll show you proof of that in just a second. It appears to be inherited in what we call an autosomal dominant pattern with male sparing. What does that mean? It means parents pass it on to their offspring, but not to the men. The men can pass it on, but they don't express it. In fact, that's where I was passed lipedema. It was through my dad's family. So my dad doesn't have any evidence of it, but his mom and his sister does. So what does that mean? It means lipedema is not your fault. It was passed on to you. So I love this study that was published years ago, and we've known for many years that the lipedema is inherited. And if you look at these different families that they looked at, the colored circles, so the black circles, are women that have lipedema. The squares are the men. The circles that are white on the inside, not filled in, are women that don't have lipedema. So as you can see, not every woman in each of these families has lipedema. Didn't pass to all of them, but it did pass to a fair number. So oftentimes I'm asked the question, well, am I going to pass this on to my daughter? The answer is maybe. We don't know, but there is a good possibility that it will be. Genes are starting to be identified that are involved in lipedema, but as you will see in some of the pictures to come, lipedema looks different in different families. And so that's one of the challenges to diagnosing it for a lot of primary care providers, is because it does look differently depending on what's going on in that family and what gene is affected or genes affected. This particular one was identified back in 2020, so it's now been 5 years, and it is not routinely tested for, but it was done in a research setting on this particular family that had 3 women with lipedema. And you can see the difference in their legs, depending on where they're at and how old they are. This gene had to do with progesterone breakdown, an enzyme that broke down progesterone, as well as increasing levels of an analgesia. So it kind of makes sense with what we see with it being hormone sensitive and pain being involved. But remember that this isn't the gene that's affecting all women with lipedema. It's only one of many. Lipedema appears to be a polygenic disorder, meaning multiple genes are increasing our risk of developing it. What is lipedema? Again, it is a condition that affects the fatty tissue under the skin, just under the skin, the subcutaneous area, not the deep visceral or abdominal fat that is affected in excess body weight from obesity. And this is a great picture of that. So as you can see, this woman with lipedema has a very tiny waist. I wish I had abs that look like that. That would be fantastic. But her legs are quite enlarged relative to her trunk. And that's what we mean by it is not affecting the adipose tissue in the deep visceral area. So it's subcutaneous, it's on the legs and the arms. Sometimes it can be in the lower abdomen, and sometimes it can go to other areas, but not typically the visceral fat, especially not early on. So what does lipedema fat look like? I'm going to show you in just a minute, but if you're squeamish or you're eating dinner or something like that, you don't have to look at these. It'll just be a couple of slides. So maybe look away if you get squeamish. So this is a biopsy of some lipedema nodules. So as you feel your legs or arms, you can feel kind of firm nodules in there. This is a biopsy of those. And I'm so happy for the women that volunteered to do this, because this is not a comfortable thing to have done. But they opened the adipose tissue up and looked at the nodules underneath. And those are the hard, firm nodules that you're feeling that the black arrows are indicating. And then you can see the white arrows, and those are fibrotic strands, really scar tissue that is being felt. And what happens with that scar tissue is it starts to retract the skin down and causes the skin to look like cellulite, or kind of lumpy, bumpy. Mattressing is what we call it. So as you can see, what you feel under the surface, you can actually see on a biopsy. In a different study, a year before that, in 2019, another set of women volunteered to have their fat biopsy, both normal fat and lipedema fat, just looking at the difference. Is there a difference? And the answer is yes, there's a huge difference. And a picture is worth 1,000 words, but some of this you're going to have to trust me on. They did special staining and different studies to come up with this information, in that lipedema fat is incredibly inflamed. So obesity fat can be as well, but lipedema fat is even more so. And there's a lot more scarring that is occurring. And you can feel that as you feel your hand over the lumpy bumpies that are in our legs or arms, where the lipedema tissue is. It's quite firm and fibrotic. That's scar tissue. The fat cells are also different. They're larger and there's more of them, although you can't appreciate that per se with the more of them in the slide that is there, but there are. There's also more fluid around the fat, where a lot of folks will start to believe that this is all just fluid retention, and that's not actually accurate. But there are leaky blood vessels, lymphatics, that leads to more fluid being present in the extracellular matrix, but it's more bound to protein there than just being typical fluid. Sluggish lymphatic flow was also noted in the study, increased number of blood vessels, dilated little tiny veins, and dilated lymphatics. So the lipedema fat, very, very different than control fat. Oftentimes, lipedema is confused with obesity. And as you can see with the slides that we just went over, it's completely different. And so we have to make sure that we get that message out, and you need to understand that as well. Pictures are worth 1,000 words again. And I picked the pictures of obesity here because of the stereotypes. If you live in the world of obesity like I do, obesity is incredibly complex. It's not just about eating donuts and being sedentary. There are a lot of hormonal triggers, medications, different things that go into excess body weight from obesity. So don't think that it's all about just eating poorly. It's not. So what are some of the differences between lipedema and obesity? So I have them listed here, and I just want to go over them briefly. I would like you to take a screenshot of this because I think this is really, really good information for you to take to heart as you start to grapple with the idea that this is not your fault and that lipedema is not obesity. It's not from lifestyle choices. Okay, so lipedema often comes on in teenage years. Always before age 30. If it's after age 30, it's a different subcutaneous fat disorder, and there are other ones out there. Lipedema is just the most common one. So it almost always presents in teenage years after a hormonal change occurs. So almost always in puberty. The fat tissue is painful. It's tender to touch, where typical fat tissue is not. Lipedema tissue is. Now, pain is a relative term. I have women all the time that come in and tell me I don't have pain. And then I'll push on their lipedema tissue and I'll find one of those nodules and I'll push on it and they're like, oh, that is tender. So that's what I'm referring to. Not necessarily that you're sitting there and you're having pain, although someone with lipedema do, but that when we push on those little nodules, they're inflamed and they're painful. Obesity fat is not that way. Lipedema fat tends to affect the subcutaneous fat, where obesity fat tends to be more in the visceral abdominal region, but it can be everywhere as well. Nice thing is that lipedema is not a metabolic risk factor for hypertension or diabetes, at least not in the early stages. And in fact, most women with lipedema have good cholesterol and low blood pressure. And you've probably heard your doctor tell you, wow, you have great blood pressure. That surprises me. Or I can't believe that your cholesterol is so good. Well, you know what? That's a perk of having lipedema. However, in later stages, that starts to disappear. So we want to make sure that we intervene in our early stages so we don't get that progression. Lipedema is not, I repeat, not a result of lifestyle choices. Although bad lifestyle choices can worsen lipedema, it is not a result. It is a genetic disorder. Lipedema fat is firm, fibrotic, and very inflamed, where obesity fat tends to be much more soft and supple and gets bigger and gets smaller. So as you can see, lipedema fat is fundamentally different. It requires a completely different approach than how we typically think of weight loss strategies. Lipedema does not respond to typical diet and exercise. And let's talk a little bit more about that. The reason being is because of inflammation, meta-inflammation, the hidden barrier. Yep. I'm not talking about the short term, you bump your elbow, it gets inflamed, red, sore, and then it heals up. That short-term inflammation, that's part of the healing process. I'm talking about chronic, ongoing inflammation. Oftentimes this isn't visible to the naked eye, but it drives the pain and the swelling and the fibrosis that is underneath. And it's that inflammation that makes the fat resistant to change. What is causing the inflammation? There's a lot of things that can cause inflammation. We'll go over that more. It can be stress, it can be diet, it can be toxins, it can be metabolic imbalance, it can be lack of sleep. But lipedema fat is resistant to traditional weight loss methods and therapies. And that's because those therapies don't target the inflammation that's present in lipedema fat. Makes sense, right? So lipedema fat, as you have seen, is not ordinary fat. It's highly inflamed, fibrotic, and resistant. So we have to do things differently if we're going to make a difference in our management of lipedema. Inflammation is the hidden factor of why traditional methods don't work, including bariatric surgery and sometimes liposuction as well. Some of the things that we do to try to help with weight loss actually can worsen lipedema. So we need to pay attention to how our body reacts. I'd like to compare lipedema fat to a softball. It's hard, firm, doesn't change. Where typical fat in obesity is like a water balloon. It gets bigger, it gets smaller, depending on what we're putting in and taking out of it, right? But not the softball. So what our goal is in managing lipedema is to take that softball and transform it into the balloon, to make it softer, to make it pliable, to get rid of that fibrosis, to help it be more normal, less fibrosis, less inflammation, improve the lymphatic function, all of those things to reduce how much fat cells grow, which is called adipogenesis. You'll see us reference that a few times. The biological and physiologic differences are completely are the most important thing I want you to take away from this webinar is that they're different. And so you have to treat them different. So what is the first step in managing lipedema? It's detoxing. So how do you detox? Do you take a supplement? Well, that's only part of it. When you look at what's going on in your body, when you're looking at the inflammation, you have to understand where is it coming from. Otherwise, you can't get rid of it. So I have had patients that don't make any progress until they start to tackle the stress that's going on in their life, or they start to sleep better. So I want you to take another screenshot of this slide to help you start to identify what is driving inflammation in your body. Is it sleep? Is it stress? Is it food intolerances or allergies? Is it preservatives or additives, vaccines, medications, hormones, environmental toxins and exposures, obesity, excess body weight from other reasons, infections and viruses, autoimmune conditions, or injury or illness? And at the heart of it are heavy metals. And I'm going to talk a little bit more about that because that's near and dear to my heart. So when you look at this, you can see some of the different causes of inflammation are in purple. Those are all the things that I have struggled with. So not all of them, but a good majority. I'd like you to take a couple minutes or maybe a couple seconds and think about in your life, what are you struggling with? What do you think is driving the inflammation in your body? And the only way you can start to change it is if you figure out what it is. And maybe it's a lot of them, like with me. So why does inflammation matter? It is the single greatest contributor to lipedema symptoms and progression. When women ask me, and I get asked this a lot, is this going to get worse? What are the risk factors for it progressing? I am at stage 2. I don't want to get to 3 or 4. How do I arrest it now? And my answer to them is we have to get control of the inflammation that is present. Why? Inflammation in the setting of extra lymphatic fluid stimulates fat cells to grow. And we've known that for a long time, not just in the studies on mice, because we're not mice, but also in human studies as well, that combination is a disaster for fat to grow. So we need to treat both. We need to treat the inflammation and we need to improve the lymphatic fluid and get that draining so that it's not stagnant. Inflammation leads to fibrosis, larger fat cells, and fluid retention, propagating that cycle, right? So we've got to reduce the inflammation. If you follow any of the world experts on lipedema, you'll know about Dr. Amato. He's out of Brazil. And I love his quote in that lipedema is not primarily characterized by extracellular fluid accumulation, like a lot of people think, edema, right? But rather by inflammation. So what are some of the risk factors for progression? And these are ones that you can change, that you can do something about. There are some things that you can't change. You can't change you're a woman. You can't change your genetics. You can't change if you have hypermobility or if you go through hormonal changes. But you can change these. And that's what I want you to really focus on and challenge you to address that so that you can start making a difference in your lipedema. Inflammation at the top of the list, right? Well, what's contributing to that inflammation? Heavy metals, that whole chart that we went over before. Foods, stress, poor sleep, obesity, all of those things, toxins, and also an overwhelmed lymph system. Now, that can happen for a variety of reasons, medications being one of them. So if you were started on a medication, you noticed your lipedema worsened or lymphedema worsened, well, maybe it was that medication. Maybe your legs are heavier because that medication is causing it. Maybe you have venous disease or varicose veins, incompetent valves, and that's adding to that extra fluid that needs to be cleared out. Maybe you've had an injury or surgery that interrupted your lymphatic system. Hard to say. Everybody is different. Some people will have primary lymphedema and where they're born with a genetic defect. So there's different things that can affect our lymphatic system, and that can progress and change over time. But our goal is to keep good care of that. Why? And I put this on here because I have a lot of patients that ask about liposuction, when to have liposuction. And in fact, we're going to do a whole webinar on that because there's so much information that you need to know before you jump into surgery so that you can have a great outcome afterwards. But to successfully treat lipedema, inflammation must be sorted beforehand. And again, I'm using this picture from Dr. Amato. He's a liposuction surgeon in Brazil. And I love this picture because it shows what I have seen for years, is that if we don't control and master our conservative management, we don't have good outcomes, even from liposuction debulking surgery. So in the first 3 pictures, you see the progression with just conservative management and at controlling inflammation. And you can see this woman lost 72 pounds, and her circumference of her legs dramatically changed. She still has a little bit of cuffing at the ankle, but dramatically different legs than when she started 6 months earlier. She then went on to have liposuction and ended up with a great result. This is a picture from 20 days out. And then what happened? She abandoned conservative management. And unfortunately, I see a lot of patients that come in frustrated because they didn't continue to take care of themselves after surgery, because sometimes it's because their surgeon said, oh, well, you're fine. We removed all the tissue. You don't need to worry about it. Remember, this is a genetic disorder. It's still there. Even if we debulk, there's a risk that it's going to come back. So really important to take good care of yourself, not just before surgery, but after as well. So I started to talk a little bit about those causes of inflammation, and I want to just target heavy metals because this is near and dear to my heart. A few years ago, actually, it's probably been about 6 years ago now, a friend of mine, a colleague, told me that he thought that I had heavy metal toxicity, having not known much about it. I thought he was crazy, and I told him that, and kept on me in that I was having some unusual symptoms. And so I went ahead and did a heavy metal detox, and things changed. Things changed in ways that I had not expected, in that the nodules in my legs were less painful and were not as hard. And that was not something that I had thought was going to happen. And that started me down that path of, okay, there's a whole nother world here in regards to lipedema that I've not yet explored. And so that's why I'm bringing this forward at this point, is in 2022. So a few years after I went through my heavy metal detox and started saying, whoa, hey, something's going on here. There was an article published that heavy metals were associated with peripheral obesity. Basically lipedema, not just central obesity and insulin resistance. So we've known for many years, many years, that obesity and insulin resistance and a lot of other inflammatory health disorders are caused by heavy metals or worsened by heavy metals. And, it was really hard for me to come to grips with that because, it's like I filter my water, I try to eat healthy, try to eat pretty clean, grow my veggies when I can. But we can't escape heavy metals. And that was really a little bit disconcerting to me. And the big bad 5, as I like to call them, being arsenic, barium, cadmium, lead, and mercury, they're found everywhere. And they are all associated with obesity. So they can be found in, obviously, contaminated water, which is what I always think of, but dust, root vegetables, some of our foods, medications, our air. So here's just a summary. I would like you to take a picture, a screenshot of this as well. So these are the 5 big bad 5, right? Listed where they are typically found and the proposed mechanisms of how they worsen obesity and fat tissue in our body. As you can see, some of them are pretty complex. All of it comes back to inflammation, but also there can be some genetic influence by those heavy metals as well. So as you can see, most traditional diets and exercise don't address heavy metals and toxins fueling meta-inflammation. It's not your fault that previous weight loss efforts did not work. Lipedema, it's different. So what is a lipedema detox? And there's really 6 pillars of detoxing when you look at any condition, but specifically for lipedema. And this is just an overview. So there was so much information that my team said, and our previous participants said, well, that's just way too much. Can you divide it up for us? So we did. And now we have a course that's 4 sessions of really delving into the pillars of treatment. But let's do an overview here really quick because we do have some time. So we're looking at the 6 different things when we look at effective detoxing: support, nutrition, activity, sleep and stress, lymphatic drainage, that's what MLD is, manual lymphatic drainage, and then supplements to round it out. So let's start with support. Why is that important? Lipedema is tough. About 85% of our patients, it affects their mental health, their coping abilities, and their self-esteem. It is not an easy condition to have. It's not something that you can keep quiet about or not tell people about. It is very physically present. And we have a fair number of patients that end up with anxiety and depression. And almost all of our patients, because of the different stigma associated with lifestyle choices, have developed some type of eating disorder. So when I think of women with lipedema, I know that we have a lot of different emotional and mental health baggage that we have to work through. And the only way to do that is to know that you're not alone and there are communities of support. If you don't have someone near you, you can always join a forum online, but make sure it's a positive one, not one that just continually is a downer. Make sure you find a support group that lifts you up. So at the end of the day, you feel better and you've learned something from it. Okay? Nutrition. Nutrition directly impacts inflammation. So we say that diet doesn't help. Well, that's not true. Diet can really hurt and it can help, but not just calorie restriction. So the quality of foods, not just calories, are what makes a difference when we look at managing lipedema. Toxin buildup is often linked to foods that we eat and to certain types of diet. So lots of preservatives, those kinds of things, we need to be avoiding that. Diets high in processed foods and in sugar fuel inflammation and fluid retention. You've probably eaten something and the next day you're like, oh my gosh, my legs really, really hurt. I know that's been me. And if you start paying attention, you will start to learn what you shouldn't have. Please listen to your body. Our goal is that you have improved quality of life, not more pain. Proper nutrition also supports lymphatic health and can improve inflammation. So proper nutrition can. So try to really clean up what you're eating and look at what you are doing. Maybe journal. Very effective way to change what you're eating. Chronic inflammation driven by diet not only intensifies pain, heaviness, but also contributes to a variety of other symptoms that have been reported: fatigue, mental fog, and lipedema progression. So we don't want any of those for you. So please make sure that you're changing how you're nourishing your body. And this is just an example of some of the traditional diets that folks have tried, and they don't target inflammation. And this gives you an idea whether it is a low calorie starvation diet or a high carb, low fat, highly restrictive diets that lead to nutritional deficiencies, or lots of processed food, some of those meal prep plans that are heavy with additives. And then obviously yo-yo dieting doesn't help us either. So take a picture of this slide if you could, just to kind of reference, understanding why traditional dieting plans haven't necessarily worked for you in the past. When we look at activity for detoxing, we need to have low impact activities to support and stimulate lymphatic flow. And there's a lot of different ones out there, whether it's in the water or vibration, rebounding, good old walking. But our goal is to stimulate venous return, lymphatic return, and reduce inflammation. Some exercises can actually worsen inflammation. Those tend to be a higher impact or physically impacting type of exercises like kickboxing or something like that, where you're getting micro tears in the muscle, which then causes fluid and inflammatory markers to come into that area. I have a patient, for example, who loves to cycle. I'm not going to tell her she can't cycle. She just has to understand that there are consequences of when she does a lot of hill work on her bike, in that her legs will worsen for 2 or 3 days afterward. That's not everybody, but that is her. And so if you notice that there are certain activities that are worsening things, please stop, change it, lighten up a little bit, maybe try something different that's a little happier for your body. When we look at detoxing, the next pillar is really looking at sleep and stress. Why? Sleep is the time when the body rests and repairs itself. It is super important. Lack of sleep is linked to a lot of health issues, not just lipedema and obesity. It's crucial for the natural processes for detoxing and reducing inflammation. And again, great quote that women with lipedema need longer sleep time. Why? Because women with lipedema have inflammation. They have a lot of healing that needs to occur. Also, when you're laying down, that's when fluid starts to redistribute and isn't in the lowest part of your body, which is in your legs, right? Poor sleep and stress causes a whole host of issues. Tends to drive our drive to eat, increases our drive to eat. Poor food choices, I like to call our drive to eat food noise. We notice a lot more food noise if we are stressed Or if we don't sleep well, if you didn't get a good night's sleep, you'll notice oftentimes the next day the pantry is calling to you, and your choices of what you want is not the good stuff. You're not alone. That's just physiology. We also know that sleep and stress, you tend to not take care of yourself as well. You don't prioritize things like physical activity, eating well, spending time with your family, relaxing. We see a lot more increase in mental health issues. But we also see physiologic issues with increased cortisol, worsening insulin resistance, worsening pain, worsening inflammation, and a compromised immune system. Have you ever gone where you've been super stressed and then you get sick? That's because being stressed affected how your body copes with illness and viruses. So all of these things can worsen lipedema. Let's talk about lymphatic drainage. But first, we need to just talk a little bit about your lymphatic system and why is it important? What does it do? Well, it's a very complex, very, very delicate system in your body. It helps absorb nutrients from around your gut. That's kind of interesting, right? About 80% of your lymphatics are around your gut, helps you absorb your nutrients. It also helps fight infection. It collects excess fluid that leaks out of tissue and out of your organs and out of your vessels. It helps recollect that and then transport and filter it back up to your heart and to be recirculated. Many times when you get sick, you'll feel your lymph nodes swollen in your neck. That's just one of its many functions, is to help fight infection. Remember, inflammation with stagnant lymphatic fluid stimulates fat cells to grow. So we need to reduce that lymphatic fluid. Complete decongestive therapy is what we call it. But really, it is made up of these different components. Manual lymphatic drainage, which is just gentle massaging of the skin to help to stimulate the uptake of fluid into the lymphatic system. Compression therapy, and that can be through garments, bandages, pneumatic pumps to help milk that fluid out of the extremities. Exercise and movement. So that can be with like deep diaphragmatic breathing or ankle pumps, calf pumps, just to stimulate muscle movement to milk that fluid out of your extremities as well. Skin and self-care. So really important. A lot of times when we start to have lipedema progress, we can have extra fluid hanging around called lymphedema, and that can start to affect the integrity of the skin, making you more at risk for skin infections. And so good skincare is super important to prevent that from happening. Education and lifestyle. Again, learning at home how you can better manage your lipedema is very important. Not all treatments are done at the doctor's office or with therapists. A lot of it you have to do on your own. So let's just talk a little bit about manual lymphatic drainage. It reduces swelling and fluid retention. It helps alleviate pain and heaviness in the areas. It enhances circulation and helps in the detox process. So really important as you're detoxing that you're doing some type of manual lymphatic drainage, either with a professional or on yourself. Again, we want to decrease the risk of progression, and the only way to do that is to remove as much fluid as we can and to reduce that inflammation. Lymphatic drainage also tends to help with skin texture and reduces fibrosis. Next on in our 6 pillars of lipedema detoxing, we arrive at supplements. Do supplements help? Absolutely. And there are different supplements out there. There's a heap of supplements. But when we're looking at the detox process, we want something that's going to help to remove those heavy metals gently, right? We want to improve our immune system. We want to restore any type of nutritional deficiencies. We want to improve the flora in our gut because we know that a lot of inflammation in our body comes from our gut flora. So when you look at supplements for lipedema, there is a heap of them out there. And I've just put some of them here. I could have put more, but this is what I could fit onto this slide. Where to start? There's a lot of different supplements out there and it can be overwhelming. So usually I say start with a detox process, then start looking at targeted ones specifically for inflammation, although a lot of the detox ones also help with inflammation. So there's kind of a progression when you're looking at supplements. You need to understand what it is that you're trying to treat. Is it from a lymph standpoint, an inflammation standpoint, from a mitochondrial standpoint, from a vein standpoint? What are you trying to get to? And it is a little bit overwhelming. And but starting with a detox process is probably the best option. So again, just to review those 6 pillars of lipedema detoxing, it's not just about supplements, it's about the process. So support, nutrition, activity, stress and sleep, lymphatic care, and then supplements. So where to start? Are you feeling a little bit overwhelmed? It's not surprising. Most of us do when we first start learning about lipedema and all the different facets of things that you can do to improve lipedema. It kind of can be a bit overwhelming. So that's why our team put together a 30-day detox course that includes how to guide you through some supplement selection. So these are the 4 that I think are the most important when we look at detoxing. So something to help with your gut flora, something to help bind those heavy metals, NAC because it helps with liver support as well as immune function. And then also replenishing those nutritional deficiencies, very important. So those are the 4 that I think are the most important when you first start your 30-day detox. And then we put a course together as well with 4 different sessions. We filmed the 3rd session actually just before we got on tonight. And I invite you to participate in that if you want to know more, or if you need more steps to try to figure out, okay, what exactly does this mean, and how do I apply that? So it's more of a step-by-step of how to detox for lipedema. So just in summary, I want you to take away from this, lipedema is not your fault. It is the most common inherited connective tissue disorder affecting women's fatty tissue that doesn't change with typical treatments for obesity. So if you're frustrated, you have every reason to be, but it's not your fault. Now what? Now it's time to do something about it. Treating lipedema requires a completely different approach. If you try the same thing and it doesn't work, you got to try something new, right? So I want you to look towards a holistic, multidisciplinary approach of detoxing and reducing inflammation so that you can achieve optimal and sustainable results. I want you to have control of your lipedema. Don't let it control you. We are here to help. That is our goal. That is our mission. I'm going to take a little bit of time and do some Q&A here in just a second. But please join us for the lipedema detox if you want to, for a 30-day course. Also, get connected. If you're not yet, follow us on social media. Check out our website for different informational blogs on there. Heap of information that's just waiting for you. I'm going to end this slideshow. And if you have questions, so that one question that you wrote down before, I would love it if you can put that into either the chat or the Q&A. So the Q&A is the one with the question mark at the bottom, and then the chat has the bubble. So either place, we're going to kind of be going back and forth between there. But this is the time for you to get some of those questions answered. Great question, Marie. So the question is about diuretics. They are often requested. Please do not request diuretics for the treatment of lipedema. It can actually worsen it. So diuretics, not only do they not help lipedema and lymphedema, it can worsen. And why? Because it makes the fibrosis worse. So your lymphatic vessels need fluid to function properly. One of the worst things that you can do is be dehydrated. If you want your lymphatic system to work properly, your lymph ends up being more gelatinous, more like goo instead of nice free-flowing fluid. So you need to be really well hydrated. If you're trying to reduce the fluid in your legs, you need to do it through movement and through compression. Also trying to find things that are triggering inflammation so that you can reduce that fluid. I hope that answered your question, Marie. Okay. Can blood work show that you have inflammation? Sometimes, not always. Sometimes women with inflammation will have an elevated CRP or sed rate, but not always. So it depends on what is going on. Sometimes it seems to be such fibrotic tissue that it doesn't seem to respond or signal things in our serum that we test with a blood test. So sometimes it's very low, a CRP. Sometimes we'll see, 4, 6, 10. Rarely do we see above that with lipedema. So it can be very low lying, but slightly abnormal. But a lot of times it's normal. So unfortunately, blood work is not very helpful. When you look at diagnosing lipedema, it is a clinical diagnosis. It is not based on lab work, scans, ultrasounds, any of that. Those are being used in research settings, but it's not prime time. It is all based on a history and physical. So you need to find somebody who knows something about lipedema if you're looking for a diagnosis. Would a primary care provider test for heavy metals? Probably not. And most of them, because most of the heavy metals that are running around in our bodies are actually sequestered in our fat tissue. And so again, testing the serum doesn't necessarily help in finding those heavy metals. Occasionally, I've heard of some patients that have had it, some heavy metal testing, but usually it's more through a naturopath or through like some alternative health testing that they will look for some of those heavy metals. So to answer your question, no. Usually a provider will not be testing for heavy metals, and often if they did, it would come back negative. So you've not been diagnosed with lipedema, and you're starting to wonder if you have it. You've noticed symptoms seem to have worsened in the last couple of months. You started HRT, estrogen patches, and oral progesterone. Wonder if that could cause a flare. Yes, yes, yes. So unfortunately, when we go through menopause, we are in a catch-22 because decreasing estrogen progesterone levels can flare lipedema. So can hormone replacement. Every woman is different. I've had some patients that absolutely loved HRT and their lipedema did not flare. And I've had some women that started HRT and it was a disaster. So just like any other medications, if you start something and your legs are changing or your arms are changing, whether it's more tender, more inflamed, more swollen, or getting bigger, something has changed. You need to figure out what. And it might be the medications you've been prescribed. Some blood pressure medicines do. In our detox course, we talk a little bit about that, in that there are some medications that can worsen lipedema. And so you need to pay attention. Anytime if I have a patient that has lipedema, I ask them, please be sure to weigh yourself anytime at the doctor's office, anytime they are starting you on a medication. You ask to be weighed. And every time you go in after that, because if the scale starts to go up or you start to feel worse, now you have objective data to share with your doctor. You know what? Nothing else has changed but that medicine that you put me on. It just helps strengthen your case in trying to find an alternative treatment. So to answer your question, yes. However, if the inflammation in your body is better controlled, you may tolerate that HRT a little bit better. So maybe consider taking a pause. I don't know, talk to your doctor about that. Try to reduce the inflammation in your body and then maybe go back to it. Again, when you look at HRT, it's a quality of life standpoint. I have some women that will not give up their HRT because it is the only way that they can stay sane. So, and then we just work on other aspects of it. So can it flare from any hormonal change? Yes. So hope that answered that question. So what type of provider do you see for a diagnosis and are lipomas assigned? So yes, so lipomas are just nodules that tend to be tender. You can have lipomas without having lipedema, and there are some other subcutaneous fat disorders where there are a lot of lipomas, not necessarily lipedema. But in fact, we're going to do a course on this, and I invite you to follow along on our website, because I'm going to do a whole course on how to get diagnosed, because it's asked so much, and who to find. If you're looking for a provider, most family practice doctors are not going to know anything about lipedema. They're going to try to tell you have lymphedema or obesity, maybe fibromyalgia, depending on how bad of pain you have. So they're often confused. So I would look towards somebody who's an obesity medicine specialist. The American Board of Obesity Medicine, ABOM.com or .org, one or the other, will have a directory of, thank you team for putting that on there for me. We'll have a list of providers that, if they're obesity medicine trained and board certified, they should have at least a working knowledge of lipedema. It just depends if they have a particular passion in that area or not. It will help give you an idea. Most vascular surgeons, because a lot of women with lipedema also have venous disease, so they see a fair amount of it. And then most of your plastic and cosmetic surgeons that are doing liposuction. But if you're not sure, look at their website, call them and say, do you take care of women with lipedema? If they're like, I don't know, liposuction is liposuction, you don't want to see them, because liposuction is very different for lipedema versus just removing obesity fat. I hope that helps. So there are some different folks out there, but really obesity medicine is probably where you want to go first. If there is no one in your region, then I would recommend, that's a physician, then I would recommend going the lymphatic therapy stand, in that looking for a massage therapist or a physical therapist that does lymphatic work. Most of them will be familiar because they're getting a lot more exposure to lipedema than other health professionals, because they're dealing with the lymphatic aspect of lipedema and then the lipolymphedema that can happen in stage 4. All right. Do you suggest with regard to compression, sizing, and pressure? I've been bruised by compression hosiery. I know. So I've been wearing compression for 21 years, and I've made some huge mistakes with wearing compression. Um, I think that if you are sensitive to compression on your legs, start with something mild and over the counter that's maybe 10, 15 millimeters of mercury. Maybe even 7 is all that you can tolerate. Something like I'm just going to reach over. This is an example of one. So this is BioFlex. And what you want to do is when you're wearing compression is that you support your entire leg, not just your stocking area, but really your lymphatics all the way up your body into your abdomen, even up to your diaphragm if you can tolerate it. Although it's a little bit hard if you have weak bladder to have compression on that. But these are BioFlex. This is just one of them, and they are specifically for lymphatic disorders as well as lipedema. And you can't really see this on there. Let's see if I can anyway, you can kind of see that there's ridges on there. And so when you move, it stimulates your lymphatics to open up and help with fluid, but not real strong. And they are just over the counter. So I would start with lower, maybe even a tight yoga pant or track pant until you can get used to it. And maybe only wear it for a few hours until you get used to it. Working with a lymphatic therapist, they can also sometimes access some of the prescription ones that are a little bit lower level before you work up to your 20, 30, or 30 or 40. Most women with lipedema cannot tolerate thigh-high compression. So this is a thigh-high compression sock. Starts at the foot, it's an open-toed one, and then it goes all the way up to the thigh, and then this helps hold it on your thigh. This little silicone, lovely strip. Oh, hate these. I have worn them. I do occasionally wear them when I have certain dresses that require it, but these itch and cause your skin to break down, and I often get blisters from them. So I don't want to discourage you from wearing them if you are required to do so by your healthcare provider, but maybe ask for a pantyhose or something different if you are trying. These just aren't friendly for lipedema thighs. So bruising occurs because of the vascular fragility, because of the inflammation. As you start to reduce inflammation in your body, the pain and the bruising should start to improve. So what do I think about the GLP-1, the semaglutides, those types of things, and weight loss medications? So there are no medications FDA approved for treating lipedema, not surprising. But we do, like in our clinics in North Carolina and in Wyoming, we do utilize a variety of different weight loss, anti-obesity medications in the treatment of lipedema, depending on what's going on with the person. So the nice thing about some of the GLP-1s, the GLP-1 GIP medications is they also do help with some of the inflammation. So they can be part of a larger treatment regimen. But again, it has to be individualized. So not everybody can take these medications, and they are not magic. So you still have to address all those other aspects in your life. Medications are just one aspect of the treatment, but for long-term sustainable results, you have to address that inflammation. GLP-1s can help with that. I understand there is not an ICD code in Canada for lipedema, so we don't have one in the United States either. We have to use a whole variety of different ICD-10 codes. So the only countries that have ICD-10 codes that I am aware of is Germany, New Zealand, and Australia have ICD-10 codes that have been assigned. There is a process that you can go through in the United States to try to get CDC to add them. Dr. Karen Herbst actually did a presentation last year, and the Lymphatic Society did, to try to get ICD-10 codes approved in the United States. I don't know the process in Canada, but ICD-11 does have lipedema. So whenever those codes get rolled out, the ICD-11, we will have at least one lipedema code that gets rolled out, or we should with that. Okay, so no, not yet, but should be hopefully coming before too long. Yeah, cross our fingers there. Great questions. Okay, so Eliquis for AFib, right? And you went off your calcium channel blocker and beta blockers when you found out you have lipedema. Do you have to be careful with supplements since you're on Eliquis? So Eliquis is a blood thinner, and there are some supplements that can thin your blood. So two in particular that are very common for women with lipedema, curcumin is one of them, and NAC, N-acetylcysteine. Both of those can thin your blood. There are some other ones that might be, but those are the two that I see most often used to try to help with inflammation and as well as for detoxing. And even though those can be beneficial, depends on your dose of your Eliquis, but it's something that you definitely should talk to your treatment provider about whether or not you can provide, what your dose of the Eliquis is and if you can incorporate anything else in there. Clearly, if you're on Eliquis and other blood thinners, there is the increased risk of bleeding and more bruising as well. So something that you'll need to talk to your primary care provider about. Okay, great question. Any other questions? I'll give you a couple of minutes. 5 milligrams twice a day. Yeah. So again, I think that you should probably talk to your primary care provider about if you are okay taking a supplement that would thin your blood, and NAC and curcumin would be the two that I would ask them specifically about because they know your history. Any other questions for me? It's fair game. I hope everybody put their question that they wrote down in the very beginning. I hope we have been able to get to that. If you have any other pressing questions, please put those through because I'd be happy to answer that. We have a couple more minutes and then we'll sign off for tonight. I'm super happy that you joined us tonight and hopefully you learned a little bit more about lipedema and feel like, you know what, I've got somewhere to go. I understand more of what's going on in my body and I am going to successfully tackle this. So, all right. Very good. Very good. Thank you all for joining tonight, and we look forward to seeing you next time. Keep watching our Facebook pages, our YouTube channels, and TikTok. We're on all of those, and hopefully we'll see you at another course. Great to have you here. Thanks so much.